Hi, my name is Yara Radwan. I am a medical doctor and a nutritionist. I work with both adults and children to help them improve their eating habits, their nutrition, and of course improve their health. Today I will be shedding a light on a very important topic, which is the latest research in the field of the effect of nutrition on mental health. We all know that the food we eat has an important impact on everything in our body. So it makes perfect sense that the food we eat also affects the brain and thus affects our mental health. The gut is home to trillions of living microbes that have important functions in our body. There is a very close connection between our gut and our brain. So this connection has been called the brain-gut axis, or the brain-gut connection. Sometimes they call the gut the second brain. We still need a lot of research to understand more about the gut microbiome. However, the research we have until now shows us that actually the food we eat has a very important effect on our gut microbiome, and therefore it can affect our brain and thus affect our mental and emotional health as well. So I took a note of some of the latest research that shows the impact of nutrition on mental health, and I'm going to read some to you. So a study published in 2020 compared a fast food American diet, which is high in saturated fat, in sugar, and low in fiber, with a Mediterranean diet. So a Mediterranean diet is a diet that is high in plant-based food, it is high in fiber, unsaturated fat like fish, olive oil, nuts and seeds, and whole grains. So they gave subjects the fast food American diet for 4 days, then they rested for 4 days, and they gave them the Mediterranean diet for another 4 days. They found that even in as short as 4 days, a dietary pattern that was low in fiber, meaning the fast food American diet, and that is high in sugar also, and saturated fat, was able to shift the microbiome towards a profile that has been found repeatedly to be associated with chronic metabolic diseases. And the other way around. So they found that the Mediterranean diet that was high in fiber and unsaturated fat was able to shift the microbiome towards a profile that has been associated with beneficial health effects. Another study published in 2019 examined the effects of dietary improvement on symptoms of depression. So this is a meta-analysis of randomized controlled trials, meaning that this is a very strong meta-analysis or systematic review. So this is really strong evidence. So they gathered 16 randomized controlled trials, which included over 45,000 participants. They found that dietary interventions, meaning more fruits and vegetables, more fiber, more plant-based food, and less sugar and ultra-processed food and saturated fat, reduced depressive symptoms in comparison to control group. Another study, this is another meta-analysis published in 2021. It included 16 studies and evaluated the association between something called dietary inflammatory index, so where they rank food based on their effect on the body, whether it's pro-inflammatory, so do they cause inflammation, or are they anti-inflammatory. So foods such as ultra-processed foods, sugar, refined carbohydrates such as white flour, all these things are pro-inflammatory. And then we have the anti-inflammatory food, which are mostly plant-based foods. We have also fish, we have olive oil, nuts, seeds, whole grains, everything that is high in fiber. So they evaluated the association between the dietary inflammatory index and mental health. And they found that when the food was more pro-inflammatory, or the whole diet was more pro-inflammatory, then this was associated with an increased risk of a variety of mental health disorders. Another meta-analysis also published in 2022, it included 17 studies with a total of over 150,000 participants, found that compared with the lowest inflammatory diet group, the highest group, so the people who were eating the most food that causes inflammation, such as the ultra-processed food, the group was significantly associated with the incidence of depression and anxiety. It showed that this association was more prominent in women. So this is interesting. So for depression, the increased risk was 49% in women and 27% in men. As for anxiety, the increased risk was 80% in women and 47% in men. So as a result, long-term anti-inflammatory eating patterns, this is what the researchers concluded, anti-inflammatory eating patterns may prevent depression and anxiety, whereas pro-inflammatory eating patterns may promote these conditions. Another meta-analysis in 2022 also included 17 observational studies with a total of over 380,000 participants, with the goal of clarifying the association between the consumption of ultra-processed food. So what we mean by that is things that are very, very processed, so sugary food, sugary drinks, high in saturated fat, high in trans fats, baked foods that is high in processed carbohydrates, in sugar, in fat. So this is the ultra-processed food. So the goal of clarifying the association between the consumption of ultra-processed food and mental disorders. So what they found is that the greater ultra-processed food consumption was associated with increased odds of depressive and anxiety symptoms. And then another meta-analysis published in 2023 found a protective effect of the Mediterranean diet against depression. Also, another 2023 literature review of 89 studies. So the researchers gathered these studies and were trying to find out what are the factors that influence mental health. And what they suggested at the end is to follow a Mediterranean diet, meaning, like we said, lots of fruits and vegetables, lots of plant-based food, fish, olive oil, nuts, seeds, whole grains, to perform mindfulness practices such as yoga or Tai Chi, and also to perform physical activity on a regular basis. So they found that all these factors have a big impact on mental health, and they can improve mental health significantly. So from the latest research, we can clearly see that what we eat has an impact on our mental health. So it is very important to pay attention to our diet, what we are eating, the food that we are consuming on a regular basis, and our lifestyle in general. However, this is not to say that food can actually cure mental illness. It is very important to note that when a person is suffering from a mental illness such as depression or anxiety or anything else, they should always seek professional help, and they should follow the treatment plan that the doctor prescribed for them. So food should never replace medication, especially when the doctor prescribed those medications as a treatment plan. However, food can be an important addition to the treatment plan, and it can enhance the quality of life of a person, especially when it's coupled with exercise. It also can be used as prevention. So as we saw from all these studies, food and the diet that we are consuming on a daily basis can have an important impact on our mental health. If you or anyone close to you is suffering from symptoms of depression or anxiety or any other mental illness, please seek professional help. Thank you so much for listening, and I'll see you in the next video.